Okay, so that was a little detour into history. Now let's get into the science. In order to understand how aspirin works, you need to know a little about a group of enzymes in our body called cyclooxygenase, which is often shortened to COX.
Cox.
Enzymes catalyze reactions. In other words, if a chemical reaction is going to produce B from A, an enzyme would help that reaction along, make it easier for that A to B process to occur. So enzymes are like little machines. They make it easier for reactions to occur. And our body has a lot of enzymes. Different enzymes carry out different reactions. So they are grouped together based on the type of reaction they are involved in. Further grouping of enzymes occurs as the functions those enzymes are involved in become more and more specific. A good way to understand this is to think about motor vehicles. Different motor vehicles carry out different functions, so they are grouped together based on the function they serve. For example, trucks are for transporting huge loads, cars are for personal transport. Further grouping of these motor vehicles occur as their function becomes more and more specific. For example, trucks for transporting concrete are grouped under concrete mixer trucks, and trucks for transporting garbage are grouped under dump trucks. Similarly, cars designed to go off-road are grouped under off-road cars or off-roaders, and cars designed to go really fast on a track day or something like that maybe grouped under sports cars. Similarly, there are enzymes in our body that fall under the category cyclooxygenase, and these enzymes are further grouped into COX-1 and COX-2. Together, COX-1 and 2, these cyclooxygenases, are present in almost every cell in the body. COX-1 is produced by cells in what is called a constitutive manner. In other words, the cells always produce them. They are very important for normal body functions such as wound healing, regulating stomach acid, normal kidney function, and so on, which is why they're called housekeeping enzymes. And then there's COX-2, which is produced by cells in what you might call emergencies. It is produced in response to injury or infection. In short, COX-2 causes the inflammation you get when you get sick or hurt. Okay, so both the COXes are very important. But where does aspirin fit in? What do these COXes have to do with how aspirin helps me? Well, folks, it will all become very clear very soon, so pay close attention now. Okay, as I'm sure you're aware, all our cells have a membrane called a lipid bilayer that keeps all the stuff of the cell inside the cell, like a bag if you want to think of it that way. This lipid bilayer is made up of these individual molecules called phospholipids. Okay, now our cells have these other enzymes called phospholipase A2, and their job is to turn these phospholipids into something called arachidonic acid. Once this arachidonic acid is made, our friends the COXes come in. Their job is to turn arachidonic acid into a group of molecules called prostaglandin endoperoxides. These are quickly turned into something called TXA2. Keep this one in mind, I'll get to it soon. It is important in people with heart conditions. And four other molecules called PGE2, PGI2, PGD2, and PGF2 alpha. The PG stands for prostaglandins. So these four together are called prostaglandins. And as far as pain and inflammation and fever is concerned, these three are most important. What do these prostaglandins do? Why are they so important? And most importantly for you viewers, why do you need to know about it? Okay, so you know how sometimes when you have an infection or you get hurt, you may notice swelling and redness. Pain is of course present, and you might also notice the inflamed area get warmer. These are all caused by these prostaglandins. For example, PGE2s and PGI2s, and to a smaller extent PGD2s as well, play a very important part in vasodilation. That is the widening of blood vessels. If you make these blood vessels wider, which are essentially tubes, If you make these tubes wider, more blood can flow through. This is why you get the redness and the increase in heat. Stretching these tubes also makes them thinner, making it easier for the fluid inside these tubes to leak out, which is why you get the swelling. Vasodilation of blood vessels in your brain is also thought to be a reason you get headaches, which makes sense if you think about it. A bigger tube means increased amount of blood. This increases pressure inside your skull. However, keep in mind the exact reason headaches occur is still unclear. Now, what about pain? Well, as I'm sure you're aware, we feel pain because there are neurons that send signals to the brain, telling you, hey, there's pain in this part of the body. Now, there's this thing called bradykinin, which is a peptide, meaning a bunch of amino acid molecules linked together. This bradykinin can simply be called a pain-producing agent, because essentially it makes it easier for pain signals to be transmitted. In other words, it makes it easier for you to feel pain. And PGE2 basically gives it a hand and helps bradykinin with its job. So it becomes even easier than usual for you to feel pain. Then there's fever. To understand that, we have to consider a part of the brain called the hypothalamus. This little bit of your brain works as your body's thermostat, maintaining your core body temperature at around 37 degrees Celsius. When you get sick, PGE2 is released in the hypothalamus that increases that set point of 37 to some higher temperature. And so you get the high temperature and fever. So these prostaglandins are a big deal. And remember, they are produced by, when you're sick or injured, COX-2. Okay, now finally aspirin comes in. Also recall from the beginning of the video the structure of aspirin. Remember this acetyl group I mentioned? Yeah, this one. Yep, keep that in mind. Okay, so in these COX enzymes, there is an active site, the part where the enzyme does its work. Without this active site, COX enzymes are useless, which is exactly what aspirin does. It comes along and transfers this acetyl group to the amino acid serine inside the active site. Basically, this blocks the active site, rendering the entire enzyme useless. And aspirin does this irreversibly, meaning the acetyl group will not leave. It will remain attached to serine within the active site for the lifespan of the enzyme. Now, always keep in mind, aspirin blocks both the COX enzymes, COX-1 and 2. When it blocks COX-2 like this, it can no longer produce all these prostaglandins. And so, aspirin reduces swelling, redness, and pain associated with injury or infection, and can also be useful for headaches. Now, remember, the human body is very complex. These same prostaglandins, when produced by COX-1 in certain cells, do not cause all of this and have useful function. So if you ever come across topics related to COXs or PGs or prostaglandins, don't think prostaglandins always equal inflammation and pain. Speaking of COX-1, remember how I talked about TXA2 earlier? Well, this is produced by COX-1 in platelets. Platelets are part of your blood and are involved in wound healing. They basically stick together and form like a mesh or something, like a plug that stops the bleeding, and TXA2 is what allows the platelets to stick. In people with heart conditions, there is an increased risk of the formation of something called a thrombus, which is basically a small glob attached to the inside of blood vessels. Platelets form a big part of a thrombus. This thrombus can break away, and now it's called an embolus, float around in the system and end up blocking some important artery or vein, which can cause serious conditions like a heart attack or stroke. By blocking COX-1, aspirin stops the production of TXA2, which stops platelets sticking together. This helps reduce thrombus formation. That's why there may be people you know who take low doses of aspirin regularly. Low doses because that's all that is needed to stop platelet stickiness. Recall, I said aspirin makes COX enzymes useless permanently, and platelets can't replace those useless COX-1s because they have no nucleus. Therefore, for the duration of the platelet's life, which is about 10 days, it can no longer produce TXA2 and therefore cannot stick. Your body replaces a portion of platelets each day, and that is precisely why low doses each day is more than enough to reduce the risk of something like a heart attack occurring in heart patients. And that's it from me, guys. I hope you found this video on aspirin informative and helpful. If you have any questions or if you have any feedback, please leave it down in the comment section, and also like, subscribe, share, all of that. And hopefully I'll see you next time with another drug. If you have any suggestions of any drugs that you would like me to talk about, please again leave it down in this comment section, and I'll see if I can talk about that drug. Otherwise, see you next time.